Welcome to the Methuselah Factor, 30 Days to Better Health. I'm Dr. David DeRose. Today we're on day 3 of our 30-day journey. Our challenge to you is move more. Some years ago, Americans were focused on a common threat, Ebola. Real fears that Ebola was going to get into America and really wipe out significant numbers in our population. What was shocking to me in the dialogue that played out is everybody was pointing fingers. Why is the government doing this? Why isn't the government doing that? The military got involved, but no one talked about personal responsibility, what I could do, what you could do to address Ebola. In researching the material, I was compelled to write a book. It was called Evading Ebola, and as a result of that book, I later came out with a DVD that's still a popular title. We call it Natural Strategies for Infectious Diseases. Among the things I talk about is moving more. And here's what the research shows. Take the winter season. If you exercise on a regular basis during the winter months, the research shows you will decrease your risk of infectious diseases. Sure, you might be exposed to the cold or flu virus, but you are less likely to get sick, about 50% less, if you're doing something on a daily basis. Moving more is not only important for our immune systems, but you guessed it, it's important for the Methuselah Factor, the theme of our series. What the researchers found is that just moving a bit more helps your blood fluidity. Let me read you something from a research group that specifically looked at this. Here's a quote. Increased levels of physical activity improve the flow properties of blood and thus reduce the risk of developing cardiovascular disease. Even small increases in activity result in some reduction in cardiovascular risk. So whether we're talking about avoiding a heart attack or stroke, or whether we're talking about improving mental clarity and mental performance, helping your diabetes or your blood pressure, improving physical performance, all these things that are linked to the Methuselah Factor, one of the keys is going to be moving more. So here's my challenge on day 3. I want you specifically to say, what more am I going to do on a daily and on a weekly basis to get more physical activity included into my program? You say, but Dr. DeRose, I already go to the health club 3 days a week. Well, how can you ramp that up? You say, well, I spend 60 minutes there. Maybe I could do 65 or 70. Well, sure, you could do that. But I would challenge you, even on the days you don't go to the health club, do something physically active. Maybe take a 5 or a 10-minute walk. Now, I know that may not sound like a lot, but again, remember the message, and I'll read this quote again. Even small increases in activity result in some reduction in cardiovascular risk. The message is, if we want the best blood fluidity, we've got to move more. Come up with strategies to increase your movement. You've heard some of the old tricks. Put them to play. Don't park right in front of the door when you go shopping. Park at the back of the parking lot and walk to the front door of the store. Take the stairs in your building. You say, we've heard about these things for years. You know what I find as a physician? I find that many of my patients know far more than they do. And it's especially true when it comes to physical activity. So dust off that piece of exercise equipment, put in just 5 or 10 minutes on it. Now I know what some of you are saying, but what happens if it's dangerous? What happens if it hurts me? In the book, we do walk through a modified, what we call PAR-Q. It's a physical activity readiness questionnaire. And that's on page 107 of the book, The Methuselah Factor. Let me just give you the bullet points. If you've got any of these things, if you say yes to any of these questions, you definitely should check with a health professional before significantly ramping up your activity. So if you're 70 years of age or older, get things checked out. If you have a known heart condition, or if you're on medication for your blood pressure or for your heart, that's another reason to get a check. If you've got chest pain with activity, or chest pain at rest, or new onset chest pain, any of these things should be red flags. Get things checked before you significantly ramp up your activity. Do you have problems with dizziness or loss of consciousness? Do you have bone or joint problems that seem to get worse when you're active? And do you have any awareness of any other reason why you should be reluctant to increase that amount of activity, well then get it checked. But let me bring this all back full circle. Many people who've been worried about activity over the years, I've said this: did you get a doctor's clearance to go to Walmart? Did you get a doctor's clearance to go over to the mall? Here's what I'm saying. Just to do normal activities and increase it, just to walk a little bit more in the shopping center, just to, instead of using the motorized cart the whole time you're in, walk down one aisle if that's the biggest step you can make. Try to do something that ramps up the activity and do it every day for the next 26 days of the program. I'm Dr. David DeRose. One of the keys to better blood fluidity, to improve your Methuselah factor, is to move more. Continue with me on this journey and you'll see the benefits that come to you.